and some of the drugs got stored in the tissues of the body, just like the skeletal muscles. The digoxin, like the cardiac glycosides, are getting stored in skeletal muscles, and emetin, which is a toxic substance, and these are going to bound with the muscle proteins and get the tissue storage. Whereas this liver, in the liver, the many of the drugs get trapped, like chloroquine, which is used to treat the malaria, epinephrine and tetracycline, emetin and digoxin. These drugs get attached to the hepatic cells or proteins of the liver. In case of kidney, once again the digoxin and chloroquine and emetin, they are going to be bound. Whereas the thyroid is one organ which traps the most of the body iodine. That means it is having the affinity towards the iodine, means most of the iodine which is present in the body get trapped in the thyroid gland for the preparation of the hormone thyroxine. And in brain also, certain drugs, brain, what you call as a protein, the chlorpromazine, acipromazine and isoniazid. Isoniazid is an anti-tuberculosis drug. Chlorpromazine and acipromazine are the tranquilizing drugs. So these are going to be attached in the brain. And the retina of the eye, chloroquine, which is used to treat the malaria, and this is going to bind with that of the nucleoproteins, so in the retina. And in the iris also, this ephedrine and atropine to certain extent, especially the melanin is present in the iris, where that's why the eye is black in color. So this is going to bind with that of the melanin and get trapped there. That's called as the tissue trapping. And bone and tissue, bone and teeth, most of this, many times, this tetracycline and heavy metals like the lead and mercury, especially the lead, and they are going to attach with that of the mucopolysaccharide of the connective tissues of bone and teeth. That's why the discoloration of teeth occurs, especially if the tetracycline is given to growing calf, because the tetracycline will get trapped in the bone and teeth tissue, then a black band will be formed. Whereas the heavy metals, most of the heavy metals, they get trapped into the bone, especially with a special emphasis of the lead. And adipose tissues, many drugs are being trapped in adipose tissues, even though it is not containing the protein, etc. Since the drugs are having more and more, what you call as lipid solubility, these drugs, especially thiopentone, a barbiturate, the ether, it's a anesthetic drug, and minocycline, an antibacterial, phenoxybenzamine, that's the adrenergic drug. DDT means dichlorodiphenyl triethylamine, or it is a toxic organochlorine compound. This get dissolved in neutral fat due to high lipid solubility and remains stored due to poor blood supply to the fat. So here, why the drugs are getting deposited in adipose tissue? Number one, most of the drugs which are having very high affinity towards the fat or highly fat soluble tissues, they are going to the adipose tissues or the fat tissues, and they get stored there because there is a very poor blood supply to the fat. Only few capillaries are going to supply. Once they get there and get deposited, they will not come back so easily unless the animal is having some cachexia or the food starvation condition. Then once again, this is enterohepatic circulation, or you can know any drug which is absorbed into the circulation, or given orally, then this get absorbed into the system through this enteral absorption. Here you can see this is the area of absorption. Here you can see throughout the intestine and large intestine, the drug is going to be absorbed into the blood vessels and going to the liver. From the liver, the biotransformation in the liver, varieties of the biotransformation drugs of happens, and ultimately the conjugation with glucuronic acid will happen, and what happens is it is once again secreted in the bile, and sometimes it gets water soluble. Then if the drug is water soluble, then it is excreted through kidney, and the lipophilic drugs are going to be secreted in the bile, whereas the hydrophilic drugs, this is the hydrophilic drugs, are going to be excreted through kidney. So that's why the half-life of the ivermectin is very, very high. This is continuously, this is going on, and the absorption takes place, but the drug is not metabolized properly, and hence the half-life of the drug increases. And next is the important terminology: absorption, distribution, then the metabolism, or it's also known as biotransformation. Your metabolism is also known as biotransformation, means the drug is transformed from one biological form to the other biological form. That's known as the biotransformation. So here the chemical alteration of the drug in the body is being done, especially in case of the biotransformation. So it is needed to render non-polar. You please remember, in any of the biotransformation reaction, the drug need to be converted to non-polar, means lipid soluble. Non-polar means lipid soluble, and compounds to polar compounds. Most of the time, the main purpose of the biotransformation is converting a non-polar lipid soluble substances to a polar or lipid insoluble substances, so that they are not reabsorbed into the renal tissues and are getting excreted. So most of the time, the simple mechanism how we can remember is the drug is converted to water soluble form. That's the simplest way how we can remember the biotransformation reaction. So little bit biotransformation, it's a little bit complicated, but we will try to make it as simple as possible. Simply remember that the non-polar drugs are converted to polar, or the lipid soluble drugs are converted to lipid insoluble drugs and getting excreted through renal epithelial cells and getting excreted. So coming to the continuation of this thing, most of the hydrophilic means the drugs which do have the affinity to the water, then they are known as hydrophilic drugs. So they get excreted in the body. Hydrophilic means the drugs which are easily soluble in the water, and the streptomycin is the classical example of the hydrophilic drugs. Neomycin, dexamethasone, etc. are not biotransferred and are excreted unchanged. And then the penicillin also, 99% of the penicillin or the natural penicillin, penicillin G sodium, is getting excreted in the kidney or through the urine without any change. So most of the hydrophilic drugs, get excreted unchanged. So there is once again there is clinical advantage and disadvantage for this thing. The drugs which are excreted in the urine unchanged will become a very good drugs for the urinary tract infection, especially the gentamicin and streptomycin, etc. They are highly hydrophilic drugs. So they get excreted without any change, and the high concentration is attained in the urine. That's how they become the drug of choice for urinary tract infection. So this is the clinical advantage. Whereas in other drugs like neostigmine and other thing, the ACHE inhibitors, it's not having any clinical significance. And mechanisms which metabolize the drugs, especially the foreign substances, have developed to protect the body from ingested toxin. This is a protective mechanism for the body, because the metabolize these mechanisms, biotransformation mechanisms, they metabolize the drugs or any foreign substances like the medications So these have developed to protect the body from ingested toxin. This is for protection of the body. And the primary site of the drug metabolism is the liver. Number one organ for the metabolism is known as the liver, and others are, what are the other organs which are involved in biotransformation are the kidney, the intestine, lungs, and plasma. Please see that the liver is the one of the important organ for the biotransformation, whereas the other organs are also important, like kidney in biotransformation occurs, intestine and lungs and plasma. All these places the biotransformation or metabolism occurs. So biotransformation of the drugs may lead to the following. Here, bio means life, means transformation. They change from one biological form to the other biological form. So this lead to the following, like inactivation of the drug happens. Number one is inactivation, and most of the drugs and their active metabolites are rendered to inactive or less active. Whenever the drugs undergo the biotransformation reaction, here the inactivation of drug occurs. Example, pentobarbital get inactivated, morphine also get inactivated, chloramphenicol, it's an antibiotic, it's going to get inactivated and get excreted through the urine. And propranolol and its active metabolite 4-hydroxypropanol this is a inactive substance, active substance to inactive substance, that's known as inactivation of the drug, especially it happens. Whereas the active metabolite from an active drug, so here many drugs have been found to be partially converted to one or more active metabolites. Many of the drugs, what happens, instead of a single metabolite, they are going to be converted to varieties of the metabolites. So the effects observed in the sum total of that due to the parent drug and its active metabolites. So many of the drugs are converted to different active metabolites and they are acting in a summation manner or synergistic manner. Then activation of inactive drug. So this is also very, very important terminology. Many times the drug is inactive when you are going to be administered, but after biotransformation it get activated. So the few drugs are inactive such and need conversion in the body to one or more active metabolites, and such drug is called as the prodrug. Prodrug is the one which is having the inactive initial drug, and after biotransformation it is getting activated. That's why the original drug is known as a prodrug. The prodrug may have advantages over the active form. It is being more stable, having better bioavailability or other desirable pharmacokinetic properties or less side effects and toxicity. Suppose you are administering the prodrugs like prontosil is converted to sulfur drug. So this prontosil, it is inactive drug. So even though you administer it in more quantity, nothing is going to happen. So, but after biotransformation, it is converted to the active principle. But that active principle is active and acts on the receptor. So sometimes, whenever the drug is having more and more toxicity, such prodrugs are being used. And here there is a table that an active drug or converted to active metabolite. That's prodrug and drug. The left side is the prodrug and right side is the active metabolite. So chloral hydrate, a general anesthetic in large animal, is converted to trichloroethanol. This is active, whereas this is inactive. And phenacetin is converted to paracetamol. Paracetamol is a non-steroidal anti-inflammatory drug which is having more antipyretic action, analgesic action. So you know, everybody of you know about the paracetamol, non-steroidal anti-inflammatory agent. And phenylbutazone, once again an SAID, it's converted to oxyphenbutazone and other metabolites which are more active than the original compound. And primidone, an anticonvulsant drug, it is converted to phenobarbital and phenylethyl malenomide. So both of these metabolites are active when compared to the original drug. And trimethadone is also converted to dimethadone, and diazepam is the centrally acting tranquilizer. It is converted to desmethyldiazepam or oxazepam. So these desmethyldiazepam and oxazepam are active metabolite of the diazepam. Originally diazepam is a prodrug. And digoxin, a cardiac glycoside, is converted to digoxin, digitoxin is converted to digoxin, and imipramine or tricyclic antidepressants, it is converted to decipramine. So you have to remember some of the examples here, important examples like chloral hydrate, phenacetin, etc. And they are the prodrugs and converted to the active metabolites, and active metabolites are going to act in the body. And the codeine is converted to the morphine. Morphine is the active principle. Codeine is a cough syrup content, and whenever it's administered, it is going to convert it to morphine. That's why the codeine containing syrups, especially the cough syrups, are not sold over the counter. Means without the prescription of a physician, the codeine containing preparations are not given because they do have the addictive property. Whereas the spironolactone is a potassium sparing diuretic, it is converted to candrena, an active principle. And losartan, a drug which is converted to E317, it's the metabolite, and the losartan is a prodrug. And apart from this one, many other products are there. The levodopa it's the prodrug of dopamine. Levodopa is converted to dopamine. Enalapril, the ACE inhibitor, the enalaprilat, that's the active form. And the alpha methyl dopa is converted to alpha methine norepinephrine. And many drugs like sulindac is converted to sulfide metabolite, and the proguanil is converted to proguanyl triazenes, and the becampicillin is converted to the ampicillin. And you can give many type of the examples like the furosil, anti-cancerous drug, is converted to fluorosil is converted to flurouridine. So many examples in this chart also you can find many drugs are the prodrugs and they are converted to their active metabolites. Here many hundreds of such drugs are there, and you can see that ramipril is converted to ramiprilat, and one of the terfenadine, it's an antihistaminic drug, is converted to the fexofenadine. Like this, many examples we can give. But please remember at least 5 to 6 examples of this category. And the next is coming to the biotransformation reactions. Biotransformation reactions, like here there are varieties of the reactions, like 2 reactions are very important here. The number 1 is non-synthetic or phase 1 reactions. Here the metabolite may be active or inactive, both are present. The first one is the non-synthetic reaction, or it's also known as phase 1 reaction. In this type of the reaction, the metabolite is converted to active or inactive substance, whereas the synthetic or conjugation or phase 2 reactions, these are all same, and here metabolite is mostly inactive. In case of the conjugation, synthetic and phase 2 reactions, the metabolite is mostly inactive, whereas in case of the phase 1 reactions, the active metabolite may be active or inactive. Please remember this the Cauchy points so that it becomes very easy for you to remember for the purpose of the examination. Simply, the biotransformation is classified into two phases, phase 1 and phase 2. Phase 1 is also known as non-synthetic reactions, whereas the phase 2 is synthetic. reactions. So varieties of the enzymes are involved in the what you call as the biotransformation. In case of the enzymes, phase 1 oxygenases enzymes are there, and the enzyme involved is cytochrome P450 oxygenase or CYT, CYP enzymes. These are also known as P450 system or CYP. So the reaction is carbon and oxygen oxidation, here dealkylation, and many more reactions are there. And the enzyme, another enzyme is there, flavin containing monooxygenase, or it's also known as FMO. So the enzyme involved is here epoxide hydroxylase, whereas the reactions are nitrogen, sulfur and phosphorus oxidation, NSP oxidation, hydrolysis of the epoxides will take place. Whereas the phase 2 transferases is known as sulfotransferase, addition of one sulfate group, whereas the UDP, that's the enzyme, is addition of glucuronyl transferase glucuronic acid, that's the UGT. So these terminologies you have to remember in future, because later we are not going to pronounce the full form, just like UGT and SULT, like that we are going to spell. So please remember the terminologies. And glutathione S transferase is also known as GST, and the reaction that's going to occur is addition of glutathione, and after addition of the glutathione, the material become more water soluble and get excreted from the body. So these are all the simple what you call as the biochemical reactions. So apart from this one, this N-acetyl transferase, or the short form is NAT. So what the action of this enzyme is addition of acetyl group to a drug, and addition of acetyl group to a drug makes it more water soluble and polar, and the drug gets excreted from the body. And methyl transferases, especially these are important in the what you call as the metabolism of the endogenous adrenaline or norepinephrine is concerned. Phenylethylamine and methyl transferase is going to convert the drug to more and addition of the one methyl group will be added somewhere, and because of this thing the drug become more water soluble and get excreted from the body. And other enzymes like alcohol dehydrogenase, whenever the alcohol is consumed, in presence of this alcohol dehydrogenase, it is the alcohol is going to be reduced to the aldehydes. Aldehyde dehydrogenase is another enzyme which is involved in the biotransformation reaction, and the reduction of aldehydes will occur. And nicotinamide DPH, diacetyl phosphate quinine oxidoreductase, or is also known as NQO, then it is a very specific enzyme which is required for the reduction of quinones drugs. So these are all the list of the enzymes which are very important in the biotransformation reaction. So here the relative size of the each pi reaction, the section. Next slide I am going to give the example. The represents the estimated percent of the drugs metabolized by the major phase 1 reaction and phase 2 reaction enzymes based on the studies in the literature. And some of the cases, more than a single enzyme is responsible for the metabolism of a drug. Suppose many times only one enzyme is involved, and many times multiple enzymes are involved in the biotransformation reaction. The CYP is the short form of cytochrome P450 oxidase or reductase enzyme. And please remember this term DPYD. What is DPYD? Dihydropyrimidine dehydrogenase is DPYD, and GST is glutathione S transferase. GST is, so later we are not going to expand this particular thing. GST means glutathione S transferase. NAT means N-acetyl transferase. SULT means sulfotransferase. and the TPMT is also known as thiopurine methyl transferase. So these are the enzymes, and UGT and UDP glucuronyl transferase. UGT means UDP uridine diphosphate glucuronyl transferases. So these are all the terminologies, and in the next chart we can see, yes, these are the varieties of the cytochrome P450 enzymes which are very much required for the phase 1 reaction. And the major part of the CYP system, cytochrome P450 enzyme system, it's a very important system of the biotransformation in the kidney is concerned, this liver is concerned. The majority of the enzyme is the CYP3A45. This is the one important enzyme, whereas the other part constitutes like this, the different forms of the CYP enzymes, means cytochrome P450 oxidase or reductase enzymes are there. And once again, here you can see, apart from a single enzyme, many other enzymes are also participating in the biotransformation, like TPMTs, NATs and GSTs. GST means glucuronyl S transferase, and many other enzymes are also present which are going to act on the drug and get it what you call as the or reduce and make it more polar and water soluble. Ultimately, the aim of biotransformation is get the drug excreted out of the body. So this thing is another thing is, see, it's a complex enzyme. This CYP450 system is one of the most important biotransformation system, and once again it's a complex biotransformation reaction that's happening inside the body. And many drugs undergo biotransformation with the assistance of these particular enzyme, especially CYP enzyme. See, the cytochrome 450, the name derived because, please get it attention here, the CYP 450, whenever the enzymes are being estimated at 450 nanometer of the wavelength, it is getting absorbed into the spectrophotometric absorption. That's why it is known as CYP 450 system. Why it is called as the system means it's the conjugation or the combination of so many enzymes like CYP1B1. This is named as per their molecular weight, etc. and the named as this thing. And these are the enzyme subcategories apart from the CYP systems.